Hi, so my article touches on elder abuse from a more medical standpoint, so I kind of switched it up from the other girls. As we see in our case study, Marjorie is not only part of the disability population, but she is also part of the elderly population, a population that is actually at higher risk for several health concerns. Members of this population who go neglected by caretakers can be found with skin abrasions, frequent UTIs, especially in females, as they are more common in females, vaginal or rectal bleeding, and pattern bruising. This can cause a higher likelihood in a change of baseline for the elderly individual, or in some cases death. A change in baseline may be in their cognition, they may be more confused more often, or they may have to transition from a cane to a walker, from a walker to a rollator, from a rollator to a wheelchair, things like that. Those who suffer from elderly abuse actually have a greater likelihood of mortality by 2.5 times as compared to their counterparts who have not experienced such treatment. And we see this just because, like the bed sores that I mentioned, those can cause very serious infections. Different things can really escalate very quickly. And with this treatment and with these cases, you'll see an increased rate of emergency room visits, which, with the increased rate and with the different medical risks they are being put in, these can lead to longer hospitalizations, especially if the abuse is not addressed. So due to this, the article actually suggests proper elder abuse screenings in doctors' offices and hospitals for all elderly patients that come in. It also recommends that specifically for female elderly patients that we not only do an elderly abuse screening, which would, be focused on neglect and other physical and medical assistances that are needed for that population, but also for women do a domestic violence screening, as there's the potential that this female elderly individual is being taken care of by her husband, and maybe this violence isn't new, as we know that women are more likely to suffer from intimate partner violence cases than men are. So it suggests that these screenings would occur with the social worker or the intake nurse, whether it is in the hospital or doctor's office setting. They would have both of those readily available. Going further, the team, whether in the hospital or doctor's office, would hotline the situation if they do find concerns of abuse or neglect, and work with the caseworker assigned to address the abuse in the form of an interdisciplinary team. So there would be multiple different factions working to assist this individual going forward. There would be law enforcement, medical professionals, and the caseworker from the state all working together to ensure a proper safety plan is followed so the individual is adequately cared for. And this would continue with wellness checks and calls from the doctor's office and check-ins from the state to ensure that the appointments are being made, to make sure that they're being properly taken to the bathroom and transitioned properly and given their medications on time. So this actually wonderfully leads to our proposal, which is also involving an interdisciplinary approach with the teamwork of law enforcement, caseworkers, and legal professionals, as well as other resource teams in the community of St. Louis. Our group would like to propose a local hotline for those with a disability to contact when their caretaker is neglecting them, thus inflicting violence onto the individual. Adults with disabilities experience violence at the rate of 1 in 4 for women and 1 in 5 for men. In the case of Marjorie, she is left to suffer without her pain medication when her caretaker refuses to give it to her, or at times wet herself when her caretaker refuses to transfer her to the commode. And that is not uncommon in the cases of neglect, actually. Our hope with this hotline is that it will serve as 24/7 call center to assist in establishing victims with safety planning and other resources to escape their current situations. However, and this is actually pretty pivotal to our point, The hotline will be disguised as a food company for the safety of the client. Those with disabilities commonly have their caretakers involved in every aspect of their lives. So to ensure that they are able to contact the hotline safely, it is pivotal that this hotline not appear as a hotline, but rather just a normal company that they're contacting. Dispatchers on the other end will be trained in trauma-informed care as a measure to ensure that the best care for all clients is done. Dispatchers will be able to send immediate alerts to law enforcement so wellness checks can be performed. Furthermore, if needed, the alerts will serve as a call to law enforcement to dispatch an officer to the caller to the hotline, of course, so they can provide safe transportation to an emergency shelter. The hotline will work to build rapport with shelters in the area so that teams at those shelters can assist when a crisis occurs and ready any available rooms they have for our clients. So that is the proposal we have. Thank you.